Well, moving on from flus to dentists, it's always in season to keep your mouth healthy. We haven't spoke to Dr. Leedy in a while, but she's here from Abilene Dental to talk to us about healthy mouths to keep us healthy in general. How are you today?
Great. How are you?
How was your New Year's? I'm asking that to everyone.
Yes, it was really great.
It was great. So I know you're back at work. A lot of clients and customers. So what I watched, because you pointed out to me that almost your mouth is sort of this window to keeping your body healthy. If whatever is exposed to your mouth, it's also more inclined to receive germs and all that bad stuff.
Yes. It would only make sense, you know, that all of the different things that go into your mouth end up getting inside you. But, you know, it's the start of the year and so many people are committing to being healthy, working out, eating better and that type of thing. But really, it's so interesting to know that one of the best things you can do for yourself is floss and brush.
Those basis foundation that we were taught in elementary school.
Yes. And, you know, we laugh in our office about people will say it's just a cleaning, and we're so passionate about it being so much more than that.
Yeah.
Because when you see that video and you see the connection, the direct connection to your oral health and your overall health.
It's amazing because it's the blood cells, and I know if you don't floss, whatever those food particles will go into the stream as well and therefore affect your health.
Yes.
Really.
And really, interestingly enough, as quickly as in an hour, you know, and in 5 hours, millions of bacteria, you know, and particularly if you're battling some type of chronic inflammatory disease, you know, or health issue, you want to look at what can I do to make sure that my oral health is the best it can be and that I don't have any infection in my mouth. You know, I had a patient just in December who actually was care flighted to Temple for an issue with his liver. And he had just gotten 2 months before a lot of dental treatment done and where we got rid of a lot of infection, and they were like, it helped so much with his healing process that his body wasn't having to fight the infection of his oral health along with healing. So it was so cool to know, you know, it just made you feel so good to know, oh my goodness, we really helped him to get healthy and he's doing good.
That's, you know, now that you mentioned that story, I just remembered a friend of mine, all his life, there's been problems. And it kind of all tied in even with heart problems, which I was really shocked about.
Yes, yes. And, you know, again, we didn't used to know this, but now there's a direct link between oral health and the health of your heart.
Oh, my gosh.
Increased risk of stroke, heart disease, lung disease, diabetes, and low birth weight babies, of all things.
Of all things. And you know, it's as simple as, like you said, just starting up, brushing your teeth. And I know it's New Year, so people are more just prompted to or inspired to do so. I just told you like seconds before we started. I just started flossing my teeth as well. Dr. Leedy, it's always a pleasure. I learn so much whenever you're here. So what our main goal for today is start flossing. That's as simple as that. But if you do want to make an appointment and get some of her help, Abilene Dental today, just call the number on your screen or head to their offices off Buffalo Gap Road. Also check them out on Facebook and Twitter. She's such a lovely lady. And for more advice of a healthy smile, search Abilene Dental on BigCountryHomepage.com.